Are you experiencing these symptoms and wondering if you might be pregnant? This video is your guide to understanding the early signs of pregnancy. Remember, every woman is unique and not everyone might experience these symptoms. The only foolproof way to confirm pregnancy is through a pregnancy test. But recognizing these early signs can help you anticipate and prepare. So are you ready to understand your body's whispers and decode these early signs of pregnancy? Let's dive into these symptoms one by one. Firstly, a missed period is often the first sign of pregnancy. Now, not every missed period is a telltale sign of a baby on the way. There are other factors to consider such as stress, changes in weight, or certain medical conditions. These can also play a role in disrupting your usual menstrual cycle. But let's not overlook the possibility. If your periods are usually like clockwork and suddenly you've skipped a beat, it's definitely worth considering a pregnancy test. Secondly, nausea or morning sickness is another common symptom. Contrary to popular belief, morning sickness isn't just a morning affair. It can strike at any time of the day or night. It's also a very individual experience, varying in intensity from woman to woman. Some may feel slightly queasy, while others may experience more severe bouts of vomiting. This symptom typically emerges around the 6th week of pregnancy. If you're frequently feeling nauseous, especially in the morning, this could be a sign. Another symptom to look out for is tender breasts. Now, this is something many women may experience right before their period, due to hormonal fluctuations, so it's not a standalone indicator of pregnancy. However, during early pregnancy, these hormonal changes can make your breasts feel sore, swollen, or unusually heavy. It's your body's way of preparing for the mammoth task of nurturing a new life, and these changes are often more pronounced than what you'd typically experience before your period. Some women also report a tingling sensation or an increased sensitivity to touch. Remember, everyone's experience with pregnancy is unique. You might feel these changes intensely, or you might barely notice them. But if your breasts are feeling different, and you're also experiencing other symptoms we've discussed, it might be a sign that there's a little one on the way. Yet, if you're noticing changes in your breasts along with other symptoms, it might be time for a pregnancy test. Lastly, 2 more symptoms are fatigue and frequent urination. The fascinating world of hormones takes center stage here. When you're expecting, your body releases more progesterone, a hormone that can lead to you feeling more tired than usual. It's like your body is putting up a do not disturb sign for some extra rest. Now, if you're finding yourself making more trips to the bathroom than you usually do, you're not alone. This is due to the increased blood flow to your kidneys, which can cause your bladder to fill up more often. But remember, these symptoms can have other causes too. Maybe you've been burning the midnight oil at work, or perhaps you've been hydrating more than usual. So it's important to consider these symptoms in conjunction with others. If you're feeling more tired than usual and making more trips to the bathroom, you might want to take a pregnancy test. To recap, some early signs of pregnancy can include a missed period, nausea, tender breasts, fatigue, and frequent urination. These are just a handful of potential indications that your body might be preparing to welcome a new life. However, it's crucial to remember that these symptoms can also be signs of other conditions or natural changes in the body. For instance, stress or changes in your diet can cause missed periods, while fatigue can be a symptom of many other conditions as well. If you're experiencing a combination of these symptoms, it might seem like your body is trying to tell you something. Perhaps you've noticed changes that feel different from your normal cycle. In this case, it could be worth taking a pregnancy test to shed some light on what's happening. These tests are readily available and can provide results quickly, giving you the information you need to understand your situation better. However, no matter what the test says, it's always a good idea to reach out to a healthcare professional. They can provide expert advice and carry out more comprehensive tests if needed. They'll also be able to guide you through the next steps, whether that involves confirming a pregnancy or exploring other potential causes of your symptoms. Remember, everyone's body is different. If you think you might be pregnant, it's always best to consult with a healthcare professional.